If you're considering your first pair of hearing aids, how do you begin your journey? With so many choices, how do you find the best hearing aids? Well, Dr. Ruth Reisman knows. She's an audiologist and hearing aid dispenser who's worked to improve the hearing of many people, including seniors. In this video, the doctoral lecturer explains the different issues that can affect people's choices of hearing aids, why what's best for your friend may not be best for you, the differences between over-the-counter and prescription hearing aids, the top brands she recommends in each category, and how to begin your quest for the best hearing aids for you. And if you have questions after watching this, Dr. Reisman is happy to answer them. Hey everyone, it's Jeff Hoyt, editor-in-chief of SeniorLiving.Org. Today I have the pleasure of speaking with Dr. Ruth Reisman. She's an audiologist, full-time doctoral lecturer, and deputy program director at CUNY, City University of New York. And she also is the owner of Urban Hearing in Brooklyn, New York. Welcome, doctor.
Thank you, Jeff. It's great to be here again. Good to see you.
Likewise, thanks for taking the time. So, we deal with a lot of seniors, and hearing loss sort of comes with the territory there. So, if a senior's worried about hearing loss, they're experiencing it, and they want some help, how can they go about getting the best hearing aids?
Yeah, it's a kind of an interesting or a complex, challenging process getting the best hearing aid for an individual, right? Every person is so different, and that's why there are so many hearing aid options out there because usually hearing aids are as unique as the individual is. But there is some ways that you can kind of navigate the process by ensuring that you have a correct diagnosis on what's actually causing your hearing loss or what the reason for your hearing difficulty is, if it's a true inner ear or nerve related hearing loss, or if there's something else that's going on that's causing the challenges or difficulties that they're experiencing. So I think always the first step is getting a proper hearing evaluation. And then from there, looking at your options that are most appropriate for the needs based on the degree and type of hearing loss that's actually presenting, um, based on the hearing test.
So a lot of it is, of course, on the individual patient's needs, what needs to be addressed in order to get their hearing, to improve their hearing. But also, aren't cosmetics sort of a part of it as well? That somebody may want to have a hidden hearing aid hidden inside their ear canal versus a visible one because they don't want the stigma of wearing a hearing aid?
For sure. I think that's one of the biggest challenges that we encounter is individuals that are concerned that the hearing aid is going to be seen or that maybe others would perceive them differently because of the hearing aid. Unfortunately, they're not wrong. There's a lot of research to suggest that there is this quote unquote hearing aid effect, but I think accepting it with accepting the loss and seeking help is probably better than not doing anything about it. But with that said, there are so many options out there that both include invisible hearing aids, hidden hearing aids. They're not the hearing aids that people think of or perceive from the past that were these much larger, clunkier looking devices. They've really become much sleeker, much less noticeable and more user friendly and quote unquote new age.
Great. And then some seniors also might have some manual dexterity issues. So inserting complicated hearing aids may be more difficult for them, and they may be better off with something that's easier to insert.
Yeah, that's very possible. And that's why we were saying that it really, we have to look at the whole patient, right? Not just their hearing loss, what their needs are in terms of dexterity, in terms of visibility, how well they're able to manage and manipulate different elements of the hearing aid, including cleaning, maintenance, battery, so on and so forth. So, yes, there are options that tend to be more suitable to individuals that have difficulties with dexterity or vision. And then there's that other side of the spectrum for those individuals who are comfortable with those elements and just want something very discreet or invisible in the ear.
And then there are some items like a friend of mine might pull up in a car and I may take it for a test drive and then decide, hey, I really like this car too. I'm going to get me one. Are hearing aids the same thing? It's like if a friend says, "Hey, I was having trouble and now I'm hearing better with this brand of hearing aid, and you should check it out." Like, does that apply as well?
So, I've had cases where, yes, I have individuals come in and say, "Oh, my friend tried this hearing aid and it changed their life. I really want the same exact hearing aid." And sometimes that hearing aid works really well for the individual, but the majority of the time, it's not necessarily the most appropriate device for their hearing loss. But because they're insistent and they have this preconceived notion that the hearing device is the best hearing aid and the greatest thing since sliced bread, we'll always try the hearing aid for them. But more often than not, they don't get this wow factor that their friend seems to be claiming that there is. So the best thing is ultimately, again, to consider the whole patient, understand what their hearing loss is, what their needs are, and provide the hearing aid that's most appropriate, or give options, I should say, for hearing aids that are most appropriate for their needs, for their types of hearing loss, and what's going to give them the best outcome in improved quality of life.
Right. And for many seniors, cost can also be a factor. In terms of the options, are there more options now at a lower end of the price scale?
Yeah, I think we're in a day and age where if you have hearing loss, you're technically considered very lucky because the options are just so vast. There are devices such as prescription hearing aids that tend to be a little bit more costly, but are more customized to the individual, to their hearing loss, what their exact needs are, and they get that hand-holding support, that one-on-one support, as well as hearing aids that are a lot more affordable, like over-the-counter devices that are meant for individuals with more mild to moderate hearing loss that can also manage some of the elements on their own and don't necessarily need that white glove service or support. So really there in some ways there are so many options that almost at every price point you can find a device potentially that would work for your hearing. Even within the prescription range, there is a wide range of price and cost, and it's all dependent on the level of technology, the style, the level of support that you're receiving, and what the individual's needs are, whether it's just hearing aids alone or potentially some other form of accessory or hearing assistive device.
Right. So if someone decides they want to try out over-the-counter hearing aids, whether it's a financial choice or they don't want to deal with going to a doctor, getting tested, getting fit, and having follow-ups, perhaps they live in a rural area and it's really hard for them to get back and forth to an audiologist. It's like, how can they find the best hearing aids for them?
One element of it is doing some form of an online assessment. So I know that there are many free hearing screenings online. Even I know Senior Living has a great hearing screening that can be done online. It's actually the one that I recommend most for my patients who are not able to get into the office and that do remote assessments. Find one that is really accurate, that's going to give you a clear picture of what's going on with your hearing and what level you're at. And based on that, you can then kind of research or look at what are the best options for that degree and configuration of hearing loss. A lot of platforms like Senior Living do give guidelines into what the best hearing aids are. And from there, you can look at which hearing device is going to fit into your degree of hearing loss that you've determined that you have based on the online screening, and then what your needs and preferences are. So something that's more invisible, something that has a lot more flexibility, something that has Bluetooth connection, something that's able to be adjusted, or something that's just very, very simple. Put it in and kind of forget it and not have to deal with all of the fuss of making adjustments.
And have you had success with any particular brands of over-the-counter hearing aids?
Yeah, I think they're not all created equal, just like all hearing aids are not created equal. There are various over-the-counter devices that have had more consistent success, I should say, with patients. Some of the ones that I've seen include Jabra, which is one of the higher level or higher premium over-the-counter devices. The reason why there's a lot of success with that is because in addition to the cosmetic appeal of the device, there is a lot of support. There's an extended trial period, so you have about 100 days to try these devices to see if they work for you. They do have actual audiologists there helping you or supporting you remotely to make adjustments to your hearing aids and make sure that you are adapting well to the devices. So if you're tech savvy and really want a high quality over the counter device without having to deal with all of the in-office follow-ups or not necessarily needing something that's so customized or unique to your hearing loss, Jabra is a great solution. One of the other ones that patients really do gravitate towards is the Eargo device. The reason why, again, I think most people are very keen on it or very excited about the device is that it's an invisible in the canal hearing device that is rechargeable. So it really sits nicely in the ear for most patients. Again, it depends on the shape and size of the ear canal, but is very well hidden. It's very small, discreet, easily portable with their charging case, and also does have that support on the back end side with the audiologist or the hearing care specialist to provide guidance on how to manage the device or get the best use out of the device. There are also some over the counters, again, that do give some good outcomes as well that can be more affordable. So if, let's say, the Jabra and the Eargo is still not something that's within reach financially, there are devices that are more affordable that have yielded some good results as well, which include MDHearing, Lexie hearing devices. Hearing aids like those, again, the styles though can vary, and they're usually the ones that are typically behind the ear, but but patients do have a lot of success with it if they're able to manage the setup on their own or with minimal support from some of the tech support from those companies.
Fantastic. And now, if someone chooses to go down the other route and says, I want someone like you, an audiologist, to test me and figure out what's best for me and prescribe hearing aids, are there any models that you recommend to your patients?
I've seen patients start, let's say, with an over-the-counter device, and once they notice that, their hearing is improved, they want to know if there's options for even better hearing, and that's when they would come and pursue a prescription device, or those that just want to pursue it right off the bat, depending on, again, on what the scenario is. Most of the time, we actually do a formal hearing aid evaluation where we would test the patient with multiple hearing aids and find what is going to be objectively, so based on the testing that we do, what objectively is giving them the best results, and again, what subjectively is giving them the best results. And we kind of take both of them. Usually they align, and we find the hearing aid that's best for the patient. Sometimes they differ, and then we have to decide whether we're going to go with their objective performance or their subjective input. Some of the hearing aid models or brands that we've seen the best success with include products like Phonak. The reason why Phonak hearing aids are great is because they do allow for a really wide range of different kinds of devices for different levels and styles and different degrees of hearing loss, including pediatrics and adults. And they do have some very unique, what we call form factors, different styles of hearing aids that fall into the invisible category. So a lot of patients really gravitate towards that. We have other manufacturers like ReSound that tend to be at the forefront of technology. So usually any advance in hearing aid technology typically comes out first by ReSound, and then we'll see all the other hearing aid manufacturers follow. So a lot of patients who are tech savvy or who really care about improvements in technologies and advancements in technology gravitate more towards the ReSound hearing aids. And then there are many other brands that really, again, can yield amazing results. And for different reasons, we select those products. Like Oticon is a great brand, as well as Widex, Signia. There are a number of brands, and we select the best one depending on, again, what the patient's needs are and what their performance is in the clinic objectively, as well as what their subjective input is.
And by subjective input, it's I think I'm hearing better, while objective input is what the test results are showing.
So yes, pretty much. We do a series of tests and with and without the hearing aids to see which one is yielding the best results, and that's our objective assessment. And then subjectively, it's a combination of this really sounds much better, and usually we can see that like light bulb effect when we put the hearing aids on the patient, and they're like, "Oh my gosh, this just opened up a whole new world for me." Um, and also using subjective rating scales. So there are various assessment scales that are research based in trying to determine what is the best hearing device for the patient. And we will typically use those scales to navigate the process and find what the best hearing aid is for the patient.
Great. And you mentioned there are patients who start with over the counter and then decide, hey, like this is good, but maybe it can be better, and they go the prescription route. So, do you have any advice for someone who's considering hearing aids for the first time? How do you suggest they start on the journey?
Yeah, I think the best way to do it, or we should say the gold standard, right, is to make sure to have a complete assessment by a clinician, whether it's an audiologist or an ear, nose, and throat physician, a hearing care professional, that's going to really give you an honest advice about what's the right route to be taking based on their hearing loss. So I think that's step one. If that's not an option, because again, you live in a rural environment or you don't have access to an audiologist, doing one of those online hearing screenings or evaluations like Senior Living, like the Jabra hearing screening, where they're going to give you a clear picture of what's going on with your ear. I think that's always step one. And then from there, once you have more information, you can do a little bit of research um, using platforms like Senior Living that gives you guidance on what are the best hearing aids based off of different factors, and either decide that you're going to take the over the counter route and try a hearing aid at the very least to get your feet wet and see how things go in that direction. And if it doesn't work out for you, then maybe go see an audiologist and see what options are available there and determine what was the best outcome or what was the best route based on what your overall assessment of what your needs are and your hearing levels are.
Right. So the big takeaway here is it's not one size fits all. It's not this is the best brand for everyone or this is the best style of hearing aid for everyone. Everyone's an individual, and you really need to see what's causing the problem so you can best address it, whether it's over the counter or prescription.
Definitely, definitely. And sometimes the case history or the reason, the cause for hearing loss is so unique that that even helps navigate what is the best device for the individual. And so knowing what the cause of your hearing loss is always step one, in my opinion. And then from there, you can make an informed decision about what the best options are for improving quality of life and improving overall hearing and communication.
Fantastic. Well, really appreciate you taking the time, Dr. Reisman.
Of course, it's always a pleasure. And if anyone ever has any questions, they can always feel free to reach out to me on either the Senior Living platform or at online at my private practice.
Great. Thank you so much.
Thank you.